Today I'd like to take the time to talk to you about plantar fasciitis. It's something we see in clinic quite a lot, and it's a very common condition to see, but a lot of people don't really know what it is, so I just wanted to share some knowledge around the subject. So to understand plantar fasciitis, we need to kind of understand the plantar fascia, which is a sheet of tendon that goes underneath the foot. It has roles in supporting the arches, it helps evenly distribute forces going through the foot, and has some shock absorption properties to it as well. It's kind of like a sheet of tendon, and because of that it behaves like a tendon, where the more stress and strain goes through it, it gradually gets stronger and does the job better. And if things can get deconditioned with it, with lack of activity, things can become less strong with it as well. Now with tendons, I've recently made a video on this, with tendons, it's one of those things that they don't mind shock and force going through them. It's kind of the nature of what they're supposed to do. But any major changes in activity or changes in what you're doing can upset them too much if the change is too big or too sudden. For the plantar fascia, that can be like a change of shoes. We often see people coming with plantar fasciitis when they've been on holiday wearing flip-flops for 2 weeks and things like that. Any big changes with routines, so people taking up running after being quite sedentary for a long period of time, those things can start to irritate it. And when the plantar fascia does get irritated, it has this repetitive cycle where it becomes easier to irritate. So you go for a long walk and say 40-minute walk, and then towards the end of it starts to get a bit painful, and the more you push and push and push, the more sensitive it gets, the more irritable it gets, to the point where maybe a 5-minute walk is getting really uncomfortable and really irritable as well. The symptoms that people tend to be if you are sedentary for a long period of time and then you go to put weight through your foot. So stereotypically, first thing in the morning, putting your heel down to the floor, being really painful. People talk about those first few steps after waking up feeling like you're stepping on broken glass. The other times, if you've been, once again, sat down later in the day, you sit down, you watch a film, go to get up, same situation. But also, going back to what we said about walking, the initiation of starting an activity like walking from being sat down can be painful, and then the pain calms down. But then as you start to put more stress and strain through it, the pain can start to come back again, and it can be quite limiting from that point of view. This used to be referred to as policeman's heel for that reason as well, because of how much time policemen spend on their feet, and often not provided with great shoes, can irritate the structures underneath. Now, sounds all doom and gloom at the moment, but there are things that can be done to help with it. As I said before, it's a tendinous structure or tendon-like structure which responds to the amount of load and stress and strain. So because of that, doing some forms of exercise can help with calming this down and with desensitizing it. You have to find the right level, because if you go too aggressive with it, it can upset it further. Another thing that can help with it is stretching. So there are lots of muscles and tendons that are around the foot. If you can stretch out the structures around there, that can decrease the pressure going through there, and that can make it more comfortable as well. Orthotics can help to help support the foot. If you have had a change in footwear recently where your foot isn't supported as well, having some orthotics to help support it a bit more can be very useful. When things are a bit more sensitive, and we do see these people where walking around the house is enough to kind of make the pain really kind of catch them out, things to help calm it down in addition to that are things like ultrasound therapy, or in some cases shockwave therapy if things are really grotty, and that can be really useful at calming things down and settling from there. But a combination of all these different types of treatments can be really useful at helping with it. The time frame is really important, as I said as well. Often when people are hobbling in, where every single step is really this agonizing pain, it is quite difficult to get things moving in the right direction, or at least takes a bit more time to get things moving in the right direction. Early treatment is often paramount for it. The earlier we can see it, the earlier we can correct it, and the easier it is to steer the ship back on a normal course. I hope you found this video useful. If you are suffering with plantar fasciitis or any other form of foot or ankle pain, don't hesitate to give us a call, and we'll see if we can need help. Thank you, and take care.